This is HealthWise Alternatives with Jackie Bell, promoting good health through information and education.
Hi, welcome to HealthWise Alternatives. I'm your host, Jackie Bell. Today we have Dr. Kristine Soly with us. She is a holistic cardiologist who has a center in Yarmouthport, Massachusetts. Thank you so much, Dr. Soly, for joining us today.
Thank you.
We have a lot to talk about, but first I want to give you some background on Dr. Soly's education, which is quite impressive. Dr. Kristine Soly received her medical doctorate degree in 1970 from the Medical College of Pennsylvania in Philadelphia, where she also did her residency in internal medicine and completed a fellowship in cardiology. She then served as the director of its non-invasive cardiac laboratory. She has since been in the private practice of cardiology and for the past 25 years has been practicing holistic cardiology and medicine, where her practice is grounded on building a strong doctor-patient relationship. Dr. Soly is board certified in cardiology, internal medicine, and holistic medicine, and is a fellow of the American College of Cardiology. She has also served as president of the Philadelphia Academy of Cardiology. I'm very impressed. Dr. Soly is the director of the Holistic Cardiology Learning Center of Cape Cod in Yarmouthport, Mass. She is a wealth of information and she provides educational seminars once a month at the center, is that right?
I do. The last Thursday of every month, I provide a free seminar. It's open to other health professionals, it's open to the public. And we pick topics that mostly are cardiac related, but have to do with holistic ways of dealing with things like blood pressure, cholesterol, coronary artery disease, things like that.
Okay. So today we're going to talk a bit about the cholesterol myth. And so that's a topic that really, I think that many people just don't understand. We're given a lot of wrong information. And if you could just explain the myth to us and maybe your holistic approach to solving that problem for many people.
Well, actually, the cholesterol myth, maybe I should give you a little background about how I actually got to it, even thinking about the cholesterol myth. My training was very, very conventional, as is every physician here in the United States. The medical school is essentially teaches you a Newtonian approach to medicine, which is a reductionistic, reducing everything to two things, cause and effect. And I had been practicing cardiology and doing relatively conventional cardiology after I first was trained. And then it occurred to me that I would send patients for cardiac cath or for bypass surgery or for angioplasty. And they would come back and the same vessel would be closed off or a different vessel would be closed off. And it occurred to me that this wasn't very much progress. Mm-hmm. Now, we had been taught in medical school that coronary artery disease was relentlessly progressive. There was no way to get rid of it. That it was permanent. Once you got it, it would eventually, if you didn't die of something else, you would die of that. And even though Pritikin, and a lot of people know about Pritikin had coronary artery disease in his lifetime and was really essentially told to pursue a sedentary lifestyle or he would die. And he didn't buy into it. He said he didn't believe plaque couldn't go away. Plaque, the part that narrows the blood vessel. And he believed that if you changed your diet and you exercised and you learned to relax, that the plaque would go away, and that's what he did. So he ignored his physicians and said that he was going to approach it differently. And he specified that at his death, the autopsy would be done, and it was, and his coronaries were clean.
Wow.
Now, you would think that science would say, this is wonderful, this is good news, plaque will go away. But they didn't. And they said, no, that's just a fluke. Plaque does not go away. We don't know what was the circumstances for Mr. Pritikin, but plaque will not go away. Dean Ornish came around and he said, no, Pritikin was right and I'm going to prove it. And he was the one who really demonstrated that you could get plaque to go away. Now, this was fortunate for me because I was in practice then and looking to do things differently. And at that point, I realized that if I didn't change my thinking from what I was trained in medical school, that I wasn't going to make a difference. Mm-hmm. And it was at that point that I began looking at how to get coronary artery disease to go away. Well, obviously one of the big things was the cholesterol myth, because I got my MD degree in 1970, and I was a cardiologist by the mid-70s, so I was practicing cardiology. And that's about when the statin drugs appeared. Now, when I was in medical school and in my training, cholesterol was not considered to be elevated unless it was over 350. Now, for people who are used to 200 or even less, that must be astounding. But that's what we believed, and we did not have anything easy that we could use to treat high cholesterol. We had immediate release niacin, which caused flushing. Patients didn't like it. And we had resins, which caused a lot of bloating and gas that would absorb cholesterol in the GI tract. And patients didn't like either medication. They were very time intensive. You would start a patient on a very low dose of niacin, and they would flush. And after about 2 weeks, the flushing would go away, where you'd raise the dose. And then they'd flush again. And they would flush for 2 weeks and would go away, and you'd raise the dose. And so you'd start them at 100 milligrams, and you'd have to work up to 3,000. And so obviously patients were very unhappy, and a lot of them simply wouldn't do it. And physicians weren't too happy either, because it was time intensive.
Right.
Then the statin drugs came out, and you could give a statin pill would lower cholesterol. There were no immediate side effects, no flushing, no GI symptoms, and cholesterol would come down. And then as they followed along, they would see, these patients, heart disease drop. And so this is a reductionistic science. Everything is reduced to two things. Cholesterol drops, heart attacks drop. Therefore, high cholesterol causes heart attacks. Well, of course, the makers of statin drugs want you to keep believing that. And they will do everything in their power to keep you believing that. But it just isn't true. Science fortunately marched forward, and what we found was that the statin drugs did lower cholesterol, but that wasn't how it worked. There was no good correlation between your cholesterol level and whether you're going to have a heart attack or stroke. The correlation was with inflammation. That when you have plaque that forms in your artery that narrows the vessel, that occurs because the lipids get into the wall of the artery. Your body knows that lipids aren't supposed to be in the wall, and so it sets up a reaction trying to get rid of it. And so this plaque in your artery now has a little fire in it trying to get rid of it. It's not successful getting rid of it, but now you have inflammation. The statin drugs are potent anti-inflammatory drugs, and they get rid of inflammation. They are not safe drugs, but they are potent anti-inflammatory drugs. The problem with using cholesterol as a guide to how much statin drug to give is because we don't have a way of measuring how much inflammation there is in the plaque. Right. People have heard of C-reactive protein, and C-reactive protein is actually a non-specific inflammatory agent. Our bodies have been making C-reactive protein since man first existed. In fact, it's a survival technique. That it's the liver that makes C-reactive protein primarily, and the liver will make C-reactive protein anytime there's inflammation in the body. It doesn't matter if it's in your plaque or in your joints, or you have a virus and you have a respiratory infection. It doesn't matter where the inflammation is, your body will make C-reactive protein. Now, it may not seem logical to us why we would want more inflammation if we have inflammation, but from caveman days, the way people died when they were cavemen, if they didn't die by the saber-toothed tiger eating them, or falling off a cliff, or bumped off by another clan member, they died of infection. And so the body will evolve techniques that will protect it. And so if you're a caveman and you get a bacterial infection, now your white blood cells recognize it, and now you're having a reaction and you're trying to kill this bacteria, your liver says, here, let me help, and puts out C-reactive protein, which goes and helps the battle. So now you have two ways of fighting the infection. You kill the bacteria, the person survives. And so this gene has become now permanently embedded in our gene pool. And the only way you get rid of a gene in the gene pool is if you die before you reproduce. Well, we're not going to die from making C-reactive protein before we reproduce. So we make C-reactive protein in response to any inflammation. And we don't much die of bacterial infections anymore. And so it's not necessarily a particularly useful gene, but it is a way that we can measure whether there's inflammation in the body. Unfortunately, if we measure C-reactive protein, we're not just measuring what's the inflammation in the plaque.
Right.
We're measuring inflammation, and any number of things can cause inflammation. I mean, arthritis, a virus, but just being obese, just being overweight is an inflammatory condition. Our fat cells actually produce inflammatory compounds which keep this fire going, and so will keep the C-reactive protein being produced. So the issue of C-reactive protein is that it's useful in telling you that you have inflammation, but it doesn't tell you where.
Right.
So, in fact, people may have heard recently, it's been in the media, that they're using statin drugs now for anybody who has an elevated C-reactive protein, whether their cholesterol is elevated or not. And little by little, very slowly, scientists and physicians are coming around to letting go of the cholesterol myth that it's the cholesterol that causes the problem. And little by little, they're embracing the concept of inflammation, because it is relatively irrelevant how much cholesterol you have in the plaque. If there's no inflammation, the plaque doesn't rupture.
Right.
It's the inflammation that makes it rupture, and that's what causes the heart attack. So that's the myth, is
Right.
that it's cholesterol, when in fact it's inflammation.
So with that knowledge, how is it that you help your patients with high cholesterol? How do you treat them? I mean, in general, what are some basic concepts that you help them to understand about inflammation?
Well, what we want actually is an anti-inflammatory approach, because the truth is that inflammation underlies all our chronic diseases, not just heart disease, cancer, diabetes, stroke, arthritis. I mean, inflammation is essentially what drives disease. If we could get rid of inflammation, we would get rid of 90% of our disease. And so my approach is to create an anti-inflammatory environment. Now, it's the safest way, it's the most cost-effective way, it's also the hardest way. People have to change how they eat, they have to learn to exercise appropriately, they have to learn how to handle stress and learn some relaxation techniques, and they have to make sure they have social and emotional support, the people who care about them, friends and family. By and large, in our lives, we tend to do what we've always done, and we eat the way we've always eaten. And since physicians have literally never been trained much in nutrition, I had no nutrition training whatsoever. I think now perhaps medical schools give a little bit, but essentially physicians don't really know how to guide patients in telling them what to eat. And I feel very strongly about the doctor-patient relationship. When I see patients, I do fee-for-service so that I can spend as much time as I want to with patients. I'm not limited by how much insurance is going to pay me, so I have to get it all in a 6-minute visit or a 10-minute visit. And I find that you can't just hand somebody a slip that says, here's a diet I'd like you to follow, and I want you to start exercising and learn to relax. Because if it were that easy, we'd all be doing it, and yet we're not. I mean, the issue in this country of obesity is very severe.
Right.
And so I find what you have to do is you've got to spend time with patients. And you can't do it in the climate that we have now, where insurance doesn't pay very much, so physicians don't spend much time.
Right.
And so what I do is time intensive. We do a lot of brainstorming, because it doesn't do any good to tell a patient what to do. You've got to find out the milieu the patient lives in. You've got to find out what options do they have available to them. And for instance, it wouldn't do me any good to tell somebody, I want you to walk every day, if they don't live in a safe neighborhood.
Right.
I mean, nobody's going to go walk if they might get mugged.
Right.
And, it won't do me any good to tell people to eat organic food if they can barely afford food, period.
Right.
So it is very important in terms of teaching patients what an anti-inflammatory diet is, which is another whole topic. But it's kind of like a modified Mediterranean diet is an anti-inflammatory diet. But teaching them an anti-inflammatory diet and then working with them to see if they can do it. Like I said, it's one thing to tell someone what you would like them to do or what could benefit them.
Right.
Then they have to come back, and then they let you know how they did or they didn't do, and then you can brainstorm. Obviously, if it were easy to change the way we eat, we would not have the obesity issue we have.
Yes.
And the obesity issue is very severe. But, learning to eat healthfully, learning to exercise regularly, and that's an hour of exercise a day. Now, I understand an hour of exercise because I work. So I go to work in the morning, and I don't get out before 6 o'clock. So I go home, I change my clothes, I get the mail, I have dinner, and I need to find an hour's worth of exercise. Now, fortunately, in my basement, I have a treadmill, and I have a recumbent exercise bike, and I have a Nautilus, and I have an exercise mat. And after dinner, I go down cellar and I do my exercise. And everybody says, after dinner? And I go, it's the only time available. And when you get a pattern established, you keep doing it. And so what I look with patients is to find patterns they can get established. And I also look to find things that they really like. Nobody will stay with an exercise program that they hate.
Right.
So the idea is, first of all, getting to know patients and find out what their belief systems, what they have available, what options, what they'd consider, what they like to do, and also to let them know that you care about them. I think it's very important that people tend to make changes for people that care about them. I oftentimes say that one of the best ways to get people to change their lifestyles is to have them fall in love. And did you ever find people, they either they divorced or they're having a new relationship, and they're so starstruck, and they start working out, they're careful what they eat, they trim down, and they get nice and slim and good shape. It's because of that love. Mm-hmm. And I feel the same way with the doctor-patient relationship. I always say you can't take care of people you don't care about.
Right.
And so I think it's very important to actually love your patients. In fact, we give our patients healing hugs. Everybody gets a healing hug unless they don't want one. But I think it's important to connect so that patients know you care about them.
Right.
That they're more likely to make changes if they're cared about.
And do you find that as a holistic practitioner that people are looking for a replacement for the statin drug? So they'll say, oh, well, I don't want to take drugs anymore. I'd rather take nutritional supplements, so I'll go see a naturopathic doctor or someone holistic, but they're still not willing to quit smoking or change their habits. So first of all, you're trying to understand your patients so that you can help them come to a place where they're going to be ready and to decide for themselves the right lifestyle changes that will create a health process in their body and reverse a disease process. But do you find that most people will come to you and they just really want another type of pill, something natural?
Yeah. That's very common. Actually, patients exactly that come to me because they don't want to take drugs anymore. And I'm very careful to explain to them that, first of all, drugs are much more powerful than the natural things that we have. It isn't that natural things don't work, because they do. They're not going to be nearly as strong as drugs. And so it's important for them to understand that if they're on medication to lower their blood pressure, I'm not going to be able to just take them off their medication and put them on a supplement and have the same result. The approach I take is, if you don't make the lifestyle changes, then you're probably not going to come off drugs.
Right.
If you want to come off drugs, you need to make the lifestyle changes. Now, life is all about choices. And a long, miserable life is not more desirable than a shorter, happier one. And people should be given the opportunity to say, it's just not worth it to me. Smoking is, of course, a particularly difficult thing for patients who are addicted to it. I don't have many patients who have continued to smoke, but I do have a very small handful. And it's very hard for them to stop. And I have one who said, I'd rather die. Mm-hmm. It's not for me to moralize. It's not for me to say how you have to live your life. I know what I do for myself, but that's for me.
Right.
And it's important to create a scenario so you can work with everybody no matter what. If somebody's going to continue smoking, it doesn't mean I'm not going to care about them. It doesn't mean I don't like them. It doesn't mean I won't help them clean up other risk factors. The likelihood is, though, if they don't change their lifestyle enough, they will not be able to come off drugs. Even if they can come off drugs, they'd be taking so many supplements they develop a gelatin toxicity from so many capsules.
Yeah. And what, well, you were talking about how important it is, that people have the support of people who care about them, around them. And how do you help people to maybe cope with or overcome trauma from the past that might actually be making them sick or preventing them from getting on a path of wellness?
Yeah. Well, you really hit on a topic that would take another whole half hour to talk about. But essentially, that's my approach. Is when I see a patient for the first time, I see him for 2 hours. And I have filled out a 7-page questionnaire, which asks them a lot of things that don't remotely have anything to do, or don't seem to have anything to do with cardiology. I asked them about, what was it like as a child? What was life like as an adult? What position were they in the family? So I asked them, what are their religious beliefs? What are their spiritual beliefs? What do they think of the future? Because trauma and stress are critically important in terms of what happens to us. In the end, it all is energy anyhow. Inflammation is energy. If we look at our bodies, we're essentially, we're not just a bunch of cells. Our cells are made up of atoms. If you look at an atom, you have the nucleus in the center. That actually has some mass, actually weighs. But the rest of the atom is space, with these negatively charged electrons traveling in orbits around the nucleus. So if you look at an atom, it's mostly space. And we're made up of atoms. Everything's made up of atoms. The table's made up of atoms. Our clothes are made of atoms. The chair, the world, the universe. But essentially, it's space. And to put in perspective about an atom, if the nucleus were the size of a ping pong ball, the orbits of the electrons would be the size of a football field. So if I took all of your nuclei in your body, which actually have some mass, they're not necessarily solid, but they have some weight, they would fit on the head of a pin. That's all there is to you that's solid. So we are essentially energy bodies, and energy matters. Thoughts are energy. Trauma is a severe form of negative energy. And the things that hurt us are negative energy. I oftentimes say when I give my talks or when I talk to patients that the most powerful influences on our energy of our atoms, which essentially make up our bodies, are love and hate. And that if you were to measure your energy field, we all have an energy field because we're made up of atoms. If I measured your energy field and I wanted to see what influenced it, if I say I fed you nice, healthy food, organic food, and nice fresh water, and I wanted to see, did your energy field become more positive, which would be good, or more negative, which would be bad, it would become a little more positive. If I took you to McDonald's and fed you, it would become a little more negative. This is just one meal. If I hold the device there and I tell you to think of someone that you love and feel that intensely, the meter goes all the way over to positive. If I tell you to think of someone you hate and feel it just as intensely, it goes all the way over to negative. So lifestyle is very important, what we eat, whether we exercise, whether we can relax, but the things that have the most impact on our energy fields are emotions.
Right.
And actually it was Dean Ornish who showed plaque could go away. And he found that, diet, exercise, relaxation, very important, but the single strongest predictor of how long you're going to live and how healthy you will be your degree of intimacy. Not sexual, not romantic, but love of mankind, people who care about you that you care about. And it's this intimacy. So that obviously trauma is a very negative influence. If you don't deal with people's trauma, you don't give them even the opportunity to change their energy field.
Right.
Yeah.
So just to sort of summarize, it seems as though your approach to cardiology and heart health has more to do with lifestyle change, nutrition, and love.
Yes.
And that really once a person starts to grasp that and starts to incorporate exercise and good nutrition into their lifestyle, that kind of puts the meter over to the positive, and it seems like every day that would perpetuate itself. They would start to feel better and better, and then have the strength and the optimism to be able to maybe deal with some of the traumas, and that would make them strong enough to be able to handle expressing them and taking on love instead.
Yeah.
Well, thank you so much for having come all the way from Yarmouthport to visit us today in the snowy weather.
Yeah.
And we're so glad that you have that center there, and we hope that it continues to grow as more people look towards the things that matter in life as a cure for their heart disease.
You're right.
Thank you. This season on HealthWise Alternatives, we will be interviewing holistic medical doctors, practitioners, and counselors who will explain natural medicine approaches to health and disease. HealthWise Alternatives is created by The Woman in You and Take One Films. Check our website, thewomaninyou.info, for scheduling information or contact your local cable access.